Hello, my name is Lawrence Amukono. I'm the Chief National Continuous Monitoring Coordinator at the Kenya Civil Aviation Authority.
Hello, my name is Penina Njeri. I am an airworthiness inspector, current manager airworthiness, and today we'll be discussing aviation protocols during the COVID-19 pandemic. You're welcome.
Like my colleague has said, today we are discussing the protocols during passenger operations in this COVID-19 environment. As the Kenya Civil Aviation Authority, our protocols focus on four main areas during this passenger operation. And the four main areas include the aircraft, the airport, cargo, and the crew. With regard to the airport, the Civil Aviation Authority has established requirements to ensure that the airport is an environment that is free from transmission of the COVID-19 virus. And in our discussion today, we will expound on the protocols in place to that effect. Similarly, we have also made requirements regarding crew and workers at the airport. We acknowledge that crew and workers at the airport will be interacting with passengers, and therefore, the protocols developed are aimed at minimizing the possibility of crew-to-crew or worker-to-worker infection, as well as worker-to-passenger infections, and also passenger-to-passenger infection during flight.
In addition to the airport and crew protocols, we will also be addressing aircraft protocols and cargo protocols. With respect to the aircraft, we will be looking at guidelines that prevent the virus from being spread when the passengers are in the aircraft. And with respect to cargo, we will be looking at the guidelines that will prevent transmission of the virus through cargo handling.
With the restart of aviation passenger air service, travelers are required to meet the normal requirements that have been set by the Ministry of Health. Specifically, we expect that travelers would be undergoing some screening at the airports before they are able to check in and board the aircraft. The basic screening elements are those that are prescribed by the Ministry of Health, including temperature and any history of symptoms that are related to COVID-19. As a result, we expect declarations to be made by passengers in terms of probably their recent travel history, any kind of symptoms they might be experiencing, and then they will also be given a screening, mostly the temperature screening, where there are maximum thresholds for normal body temperature. These are basically aimed at ensuring that we, as much as possible, do not have a person who presents symptoms or who has a travel history to an environment which would probably lead to some infection is being admitted for flight. This will be subjected to all travelers to ensure that we do not have a passenger being admitted and is outside the range of those parameters. Those are basically the only declarations we are looking at for the time being in the commencement of local passenger travel.
Regarding the resumption of operations on all operators, we are still evaluating operators that have expressed interest to resume operations, and once each operator meets the minimum requirements, we will be able to authorize them to resume operations. So it will be on a case-by-case basis for each operator. Regarding the certification of airline personnel from the authority, we do not require any extra certification for the airline staff. However, we've provided guidelines to the operators where they're supposed to come up with procedures that will guide the operating staff in their organizations on how to mitigate the spread of this pandemic. And what we require is that the operators develop procedures which are evaluated by the authority, and once approved, mandatory training will have to be conducted to their staff to ensure that they are all aware of the safety measures undertaken by the operator.
In the course of resumption of passenger travel, it is anticipated that in one case or another, there could be a situation where a passenger presents symptoms while on board the aircraft. What we have made in the requirements is that the airlines have to make provisions for possible isolation of such passengers from the rest of the flying public while on board the aircraft. What this means that in the protocols presented by the airlines, we expect a provision on how they will be undertaking this isolation. For example, an airline may decide to set aside a number of seats in case there's a person who presents such symptoms, the person can be isolated in those seats. Further, in line with the Ministry of Health guidelines, there would be minimum requirement of how far apart those people should be from the rest of the passengers. As a result, we are looking at protocols that define how far you isolate those people, but paramount importance is that if anybody becomes symptomatic while on board, they have to be isolated. And of course, at the arrival stage, the Ministry of Health would take care of the rest of the passengers on that flight to ensure that there is enough interventions in case there has been any transmission.
So why physical distancing is not emphasized in an aircraft is because, first of all, the air quality in the cabin is guaranteed by having the high particulate air filter or ensuring maximum flow in an aircraft cabin. And then the approach towards prevention of the spread of a pandemic is ensuring that first we do not have a sick passenger on board. So the approach is preventive. We take all the measures before the passenger boards the aircraft to prevent them from getting into the aircraft. With respect to cabin air, manufacturers recommend that maximum airflow is maintained in an aircraft to ensure that the virus is not spread to the traveling public. However, the high efficient particulate air filter gives a 99.9% efficiency to ensure that the virus is not spread. This is what is commonly used in hospitals. So for aircraft that are not fitted with the HEPA filter, the manufacturers have recommended different practices depending on the aircraft. So our role as the authority, depending on the type of aircraft that the operator operates, we will ensure that each operator is given the guidance from the manufacturer to ensure that the traveling public is not infected.
In terms of limiting onboard service, it is one of the interventions that is being proposed to ensure that we limit person-to-person contact while on board, and as such limit the potential for the virus to be transmitted across different people. The operators have to come up with a proposal on how they intend to adjust their in-flight services. We have seen situations where air operators have proposed prepackaged in-flight meals being served before departure, and that then limits the amount of interaction between the cabin crew and the passengers. That is one intervention that is being proposed in terms of mitigating against the flow of the spread of the virus. In terms of the air ticket, well, we expect challenges for the operators in adjustments to the new environment. However, from the aviation safety and security oversight regulatory perspective, the air ticketing might not be within our control. It is therefore a situation to be seen when the air operators come up with air ticket pricing, bearing in mind their operational costs, and we expect that with the desire to spur restart of aviation, this pricing would not be inhibitive. While we are at the initial stage, we are preparing for restart of domestic air transport. In this manner, we do not foresee a situation that requires rapid testing at arrival for domestic passengers. In terms of international passengers, it is also a situation that is evolving. It is evolving in the sense that today, International Civil Aviation Organization has issued guidelines on conduct of international passenger air transport. And in these guidelines, the requirement for rapid testing is not included. As a contracting state, we therefore do not see the necessity to include that requirement in our restart protocols. Further, we also need some scientific justification or scientific proof of the reliability of some of these rapid testing. Otherwise, if we include them, then it will be an additional requirement that does not positively impact the process. So from the planning that is being put in place, we have not put in place the need for rapid testing of international passengers on arrival. However, the other screening approaches that have been proposed by both the World Health Organization and the Ministry of Health will be upscaled at international arrivals, and that should give us a baseline to see the potential risks that the passengers who are arriving come with, and also coupled with contact tracing and the other Ministry of Health interventions, we should be able to exactly address any situation that may arise where passengers arrive without the symptoms and they develop the symptoms later. The approach to restart of passenger travel is to ensure that there is risk-free environment for both the aviation worker as well as the traveling public. Now, with regard to aviation crew, there are two sets of crew. We have the cabin crew who are responsible for taking care of passengers in the cabin. These are the crew who interact with the passengers throughout the flight. The airlines are expected to come up with protocols, and one of the issues we've seen the airlines come up with are crew who have been suited with PPEs, okay, the personal protective equipment, to ensure that in their interaction with the passengers, there is minimal risk to being exposed to a virus from either an infected passenger or in the unlikely event that the crew are themselves probably infected, there is minimal risk for them passing it on to the passengers. Now, the flight crew, who probably would not interact with the passengers physically, will be affected in international flights where we have flights that are long haul in nature, where crew are not able to go to their destination and come back within the same flight cycle. The collaboration, cooperation, and communication approach that has been proposed by ICAO will allow us to have an arrangement with states where crew who are going out to countries where they cannot fly back immediately would be able to take their rest period within identified facilities and be able to fly back without necessarily going through the quarantine process. In an effort to restart aviation globally, everybody is interested in getting the aviation wheel turning. And if we quarantine crew all over the world, there'll come a time where we have crew quarantined in various places of the world and nobody to fly the aeroplane. So there would be some arrangement to ensure that crew are not quarantined for the prescribed quarantine durations, but are given facilities for rest and are able to take their next flights back to their destinations without the need for the entire quarantine period. These are arrangements that will be seen to play between countries, because countries that will receive international passengers from another country would actually be sending passengers there also, and as such, that mechanism is going to be easy in terms of reaching inter-country arrangement.
With aircraft parked for a long time, we already have maintenance tasks that are published by the manufacturers, and in turn, we approved aircraft maintenance programs that describe what maintenance tasks ensure an aircraft is airworthy, whether it's being operated or it's being parked for a short or a long time. So we already have approved maintenance programs with the operators that ensure the aircraft are airworthy, irrespective of the state of operation. In a case where the aircraft maintenance program has not catered for the long-term duration of storage, manufacturers have already provided the guidelines, and the same are being implemented by the operators. So every day there is maintenance being carried on the aircraft to ensure that it is airworthy. In connection with ensuring that the aircraft is airworthy, the authority issues a certificate of airworthiness, and this certificate of airworthiness is linked to a certificate of release to service, which ensures that the aircraft is airworthy. Since the certificate of airworthiness is valid for 1 year, the certificate of release to service is a shorter term certificate that ensures that that the aircraft is airworthy within the shorter period. So immediately a maintenance task is performed, a certificate of release to service is issued, and so that will base our decision on allowing an aircraft to fly. So part of the requirements of an operator before they are authorized to fly is that they will submit to us a certificate of release to service on maintenance that has been performed during the storage period.
The use of passenger aircraft for cargo transport was initiated as a result of the need for mass movement of cargo, and also to retain some of these companies in operation because passenger operations were stopped. Now, when passenger aircraft are used for cargo, there were two ways of transporting the cargo. The cargo would be transported either in the belly of the aircraft, where cargo is normally transported, or within the cabin, where the seats are. As a requirement, all aircraft will have to undergo disinfection to ensure that they are safe for passenger operation. Similarly, the cargo to be transported on this aircraft together with passengers will have to undergo appropriate disinfection. That means cargo would have to be disinfected before it is loaded on the aircraft, and appropriate measures will be taken both at the departure and arrival airports to ensure that any cargo arriving or departing has undergone through this process and therefore does not present an opportunity for spread of the virus. Regarding passengers' air safety in the process of traveling by air, when a passenger is traveling by air, they go through various ecosystems. There is a portion of your travel between your house or the hotel and the airport. Then there's a portion of your travel where you're within the airport environment from the time you check in to the time you board the aircraft. Then there's a portion of your travel where you are on board the aircraft. And finally, the portion of travel where you disembark from the aircraft, and if it's an international flight, you go through customs and immigration, and if it's a local flight, you go through the arrival processes and baggage claim. In the whole of this ecosystem, we have placed various responsibilities on various players in taking care of the passenger and ensuring that the passenger is not exposed to the virus. At the time you get to the airport, that's where our arrangement with the passenger starts. The airport authority, together with security personnel at the airport, will have to take the passenger through security screening. Security screening ensures that we do not import any undesirable security situation into the aviation system. And the protocols developed by the airport operator together with the security apparatus are such that in the security screening process, we want to minimize contact with the passenger to the greatest extent possible. That means the screening is done in a manner that it does not encourage interaction between the security personnel and the passenger. And where that interaction is going to happen, there are necessary protective arrangements that have been put in place. Within the airport environment, before you board your flight and that kind of an environment, the arrangements at the airport are such that the airport operator is required to ensure optimal number of passengers within the terminal building so that there is avoidance of crowding and there is also avoidance of interaction between passengers in a manner that would transmit the virus. This is achieved through the constant wearing of masks and social distancing within the terminal building. Of course, we've discussed at length how you go through the arrangements within the aircraft and the arrangements of the air operator, taking care of you on board, including the kind of environment in the aircraft that benefits from air cleaning continuously. So the other part is at the time when you disembark from the aircraft and you go through the arrival procedures. Again, this is the responsibility of the airport operator. And they have made sure that in scheduling or in managing incoming passengers, there is sufficient space between flights and there is sufficient space within the terminal building to handle the number of passengers that would be arriving on that flight. So we minimize physical contact and we minimize crowding within the airport environment. And it is therefore imperative to say that with air travel, arrangements have been put in place between the airport operator, the air operator, and of course overseen by the regulator to ensure that we minimize the chances of a traveling person contracting the virus within the aviation traveling ecosystem.
KCAA has been working with different agencies to ensure that we are safe and secure. We've been working with Kenya Airport Authority, with Port Health, and all aviation stakeholders in general, our air operators, maintenance organizations, training organizations, to ensure that the protocols that have been set will meet the requirements to ensure that we are safe and secure. My name is Penina.
And my name is Lawrence, and this has been Ask Your Aviator series. We thank you for engaging us, and we'd like to encourage you to share your comments, your questions, and your concerns with us.
You can reach us on our email, askyouraviator@kcaa.or.ke, or on our social media platform, Twitter, Facebook, or Instagram.
Once again, we'd like to reassure you that even as we restart the aviation industry, passenger travel, the Kenya Civil Aviation Authority, together with other stakeholders in the aviation industry, have taken all measures to ensure passenger safety during this travel. It is our pleasure to welcome you back into air travel and give you the affirmation that everything is going to be taken to ensure that during your travel, you are not at risk of contracting the virus in the aviation system. Thank you.